Um, so firstly, I just want to say that it's a privilege to be able to talk about something like this on an international platform. Teenage pregnancy is an incredibly significant mental health issue in South Africa at the moment. And to be able to give a global platform is really wonderful. Just so you know who I am Dr. Stanbridge. I am a women's mental health psychiatrist, and I'm based in Cape Town in South Africa. Most of my clients call me Dr. Jess, and I mostly work in the private sector, but I also do a lot of work as part of the Women's Mental Health Executive Committee for the South African Society of Psychiatrists. And essentially, the kind of work that we do is based on a significant women's mental health events that occur within the country. We collaborate with media. We work a lot with stakeholders and other parts of our department, like Department of Health, Department of Education, Department of Justice. And really what we're trying to do is bring education and eventually interventions to significant women's mental health events that are occurring in our country. So just to give you an understanding of where this topic came from, which is the topic of teenage pregnancy in the South African context, at the end of 2023, there was a media statement released by the Department of Health that reported that there was a significant increase in the amount of babies born to teenage mothers in South Africa over the festive period. And the South African Society of Psychiatrists and the South African Society of Obstetricians and Gynecologists both released media statements around this that actually got significant amounts of airtime in the South African media. And this was the most read mental health article in South Africa in 2024. So we released an article during Pregnancy Awareness Week, and really the media statement was about looking at the alarming rise in teenage pregnancies, with its emphasis on the critical mental health impacts on teenage mothers and the multifaceted challenges that were faced by this very vulnerable demographic. And obviously the next generation, which is the generation of children that will come after them. So just to give you an idea of our statistics at that time, well, these are more numbers than anything else, in South Africa over the 2023 festive period, it was reported that 147 of the 1,708 babies born on Christmas Day were born to teenage mothers. And on New Year's Day, 190 teenagers gave birth, two of whom were reported to be actually only 14 years old on that day. And those were from two of our provinces, which were KwaZulu-Natal and the Eastern Cape provinces. To give you an understanding of kind of where South Africa lies in the low to middle income countries context, I'm just going to pull a little bit from the World Health Organization fact sheet on adolescent pregnancy, which was released in 2023. And they're actually mostly looking here at statistics of adolescents between the ages of 15 to 19 in low and middle income countries. And our statistics over periods are to be between the ages of 10 and 19. But they had estimated that 21 million pregnancies occurred in adolescents between the ages of 15 to 19 in low and middle income areas, and 50% were unintended, and they subsequently resulted in an estimated 12 million live births. So of the 50% of the unintended pregnancies in adolescents, these resulted in abortions, and these are often very unsafe in lower middle income countries. Due to legislation, limited access to termination of pregnancy. Just to note that South Africa is not one of these. Our legislation, termination of pregnancy is legal in our country, and access is actually quite good. They were starting to get a more robust data on the 10 to 14 age group, and they showed a birth rate in 2023 as about 1.5 per 1,000 women, with the highest in sub-Saharan Africa, which is significant to us, obviously Latin America and Caribbean. And then there was a bit of a positive stat that they threw out there, which was that there'd been a decrease globally in the adolescent age group, 15 to 19, and the birth rate had dropped from 64.5 to 41.3 births per 1,000 women between the years of 2000 to 2023. So just to note that that's an incredibly significant time period, that's 23 years. Unfortunately, in the South African context, it wasn't as positive. The adolescent birth rate for South Africa continues to increase every year. And between April 2021 and March 2022, 90,000 pregnancies were recorded in the sorry, let me just go back, in the girls between ages 10 and 19, and that increased to 150,000 young girls in the 2022 to 2023 cycle. So this is just a really nice image that is pulled from an article that was published in The Lancet in 2022. It was a systemic review, and it looked at mental health problems and service gaps that were experienced by pregnant adolescents in sub-Saharan Africa. So these are sub-Saharan Africa stat information, and we are obviously just South Africa, but all of these definitely do apply. So first and foremost, we have to look at life course factors. So obviously these young girls, they have adolescent brains, which are biologically vulnerable, and they're in an incredibly vulnerable state developmentally. And all of these vulnerabilities place these young women in a very significantly vulnerable place for the development of mental health conditions. The second thing that they talk about is macro system factors, and this is about gaps in mental health services for pregnant adolescent girls and young women. And these are incredibly significant in the South African context as well. A lot of young girls and adolescents who fall pregnant in this country find that there's a lack of confidentiality with regards to the mental health care that they're receiving. They also find that the attitudes of mental health care workers towards them are significantly judgmental, and they subsequently don't seek help. There's also a lack of standard treatment guidelines for this population, as well as a lack of sexual and reproductive health services for adolescents. Then there's always been a challenge in our country with regards to engaging male community members in health discussions, and also there needs to be an integration of our mental health care services. The exosystem factors that put these young girls at risk for the development of mental health conditions include a lack of basic needs, such as food security, financial challenges, even things such as the lack of transport. You know, the antenatal follow-ups for these girls are very, very poor. And the reason why is that they really don't have the transport systems to be able to get in and out of the clinics. And if we think that the antenatal follow-up is very poor, you can imagine that when they start to develop mental health symptoms, that accessibility even gets harder. And that's also associated with the mental health stigma that's associated in these communities, as well as really limited access to mental health care services. And then the microsystem factors, which I'll go into in a little bit more detail because I think they're quite pertinent as well. And these are familial and community rejection, which a lot of these young girls experience. The school dropout rates are really high. There's a lot of partner denial and intimate partner violence. And then lastly, these young girls have increased rates of substance use, increased rates of stress, guilt and loneliness. And then if one's having unprotected sex and falling pregnant, there's often a risk of HIV and other STIs, and those infections can subsequently put them at risk of mental health conditions. And they often feel a low sense of hope and dreams for the future, as their lives have not quite turned out the way that they had initially thought. And then chronosystem factors, obviously the sub-Saharan Africa has been deeply impacted by the HIV/AIDS epidemic, and there have been historical shifts in gender norms, as well as our health system policies and service delivery developments that are quite delayed across the board. So really, what are the mental health implications for these young women? They obviously have physically higher risk pregnancies, and this was a statement released by the South African Society of Obstetrics and Gynecology. They have an increased risk of preeclampsia, they have an increased risk of perinatal infections, preterm delivery with NICU admissions, as well as perinatal mortality. And they have a much higher risk of depression and anxiety, both in pregnancy and postpartum. And the rates actually lie between 16 and 44%, with obviously the development of mental health symptoms in adolescents can change the trajectory of their mental health risk going forward. So they have increased longer mental health implications. They also have increased risks of suicidal ideation and attempts, and suicidality ranges from around 11 to 30% and attempts at 9%. I think with regards to elevated substance abuse, it ranges between 11 to 52%. This is a pretty large range, and that's due to the underreporting that obviously is often taken into consideration. When people are using substances in pregnancy, it comes with a lot of guilt and shame, and so there's a lot of underreporting with regards to it. And then the other thing to really pertinently note is that there's an increased risk of post-traumatic stress disorder. And a lot of this is about their physical environments that they find themselves in as young pregnant women. And one study found on average that these teenage mothers have experienced more than 5 traumatic events And these included physical attacks by their partners, neglect, abuse by a parent, and traumatic loss. And adolescent parents were actually 2 to 3 times more likely to be victimized by their partners, the father of their child, or their family members. So there really are significant mental health implications with regards to teenage pregnancy. And then not to forget their infant mental health and the development of the child. They are more at risk of behavioral health problems and need to be monitored going forward with regards to their own mental health. So one of the major mental health risks that I want to talk about is about unplanned pregnancies. It's something that happens a lot in the South African context. And as we just saw in the previous statistics, teenage pregnancies are more often than not unplanned pregnancies. And one of the most protective factors for good mental health in pregnancy is actually appropriate planning, as we know, and the acceptability of pregnancy. It's linked to improved mental well-being. And so these unplanned pregnancies have a much lower acceptability and results in an increased risk of depression, anxiety, quality of life, and antenatal bonding. Another major mental health risk that we have to talk about in the South African context is socioeconomic. So many pregnant teenagers drop out of the school systems in South Africa. There was a report by the Department of Basic Education in 2021, and it actually said that 1 in 3 girls aged between 10 and 19 in South Africa who fall pregnant do not return back to school. And this has long-term repercussions for their lives. They are unable to enter the workplace as a young mother. Having caregivers for their children is incredibly limited. They don't have flexibility with regards to work. They have a lower education status. And we live in a country that is already particularly high with regards to its unemployment rate. We have a high unemployment rate of 33%, and in youth that increases up to 40%. And they also increase societal repercussions of reduced status in their communities. They have significant levels of stress. There's a lot of peer rejection, family rejection, as I said, interpersonal violence. A lot of them land up single parenting, and some of them are even forced into early marriage. So this is about the mental health risk associated with gender-based violence, which is a massive, massive issue in the South African context. And teenage pregnancy in very young adolescents, aged between 10 to 14, is evidence of statutory rape according to the South African legislation. And this results in an incredibly complex picture of gender-based violence and its impacts on the mental health of women. So just to go over a little bit of the crime stats so that you can understand how significant this is. Pregnancies resulting from sexual assault in young girls and adolescents. So there was a report that was released by Statistics South Africa in 2024, and it looked at the South African crime against children. These are classified as children under the age of 17 years old. It doesn't define them based on whether or not they identify as female or male, but it showed 106,000 rape cases against children over the past 6 years. And these were linked to teenage pregnancy, decreased self-esteem, worthlessness, suicidal tendency, and self-harm. It's also important to just note on that number that that is reported cases, and a large majority of the rape cases in our country go unreported. Then with regards to the reported cases, over a 4-year period of the significant number, which is probably a little bit lower than 106,000, only 1,710 cases have been brought to trial in the last 4 years in this country. So there is a massive discrepancy between what is reported and what the outcomes are with regards to the Department of Justice. So what kind of interventions can we put in place? The first one is to plan pregnancies as much as possible, and that is about access to contraception. So it is incredibly important that these young girls have access to safe and affordable contraception, and that women of all reproductive age do. And in South Africa, adolescents actually have the highest unmet needs regarding contraception access, and 1 in 5 women of reproductive age report their contraceptive needs to be unmet. One of the biggest issues around this is that these young girls go to the clinics, they go to the family planning unit, and they are judged and they are chastised by whoever is in that family planning unit, and they are sent away told them to abstain and not given any contraception. They are also very fearful of judgment of their local communities, and if they are going into clinics and they are seen going in and out, they are subsequently asked by their communities why, and it is very, very hard in these communities to have any sort of confidentiality and privacy. Other interventions that need to be implemented are specific healthcare services that are obviously very adolescent friendly. Like I've just said about the judgment around contraceptive care, we need to access non-judgmental and patient-centered care by all healthcare professionals. And we need to improve accessibility to local clinics. Obviously, clinics in this country, they are open during school hours usually. It's very difficult for these girls to go in and sit in long waiting lines in the clinics. And so for clinics to stay open longer hours would result in increased access to both antenatal care, to contraception, and to mental health services when they need it. We also need to increase the uptake of self-care interventions as recommended by the World Health Organization, and this includes over-the-counter emergency contraception, general contraception, self-access pregnancy test, and as well as self-administration of medical termination of pregnancies. Then we need to have interventions that are collaborative, and one of them is with regards to the Department of Health collaborating with the Department of Education. We need to ensure early onset of sex education teaching with incorporation of contraception education as well as female advocacy, emphasizing education for boys around unintended fatherhood and improving advocacy for them around contraception as well. And as well as retention of scholars following pregnancy. So that 1 in 3 dropout rate, what we're hoping is that despite falling pregnant and having a baby, that these girls are welcomed back into the school systems and can finish their education. And then with regards to the Department of Justice, collaboration needs to happen around the significant amounts of gender-based violence and statutory rape. With improvements in justice outcomes, it's incredibly hard to report when we know that the outcomes are so incredibly bad. And then lastly, just the most important thing from a mental health perspective is also to flag these young girls really early so that they need ongoing mental health care through pregnancy and postpartum. It's a very, very challenging thing to occur in a very challenging context with limited access to healthcare. And these teenage pregnancies, the women usually really struggle to make antenatal care appointments. And so it's really, really hard to flag them early. But if we can, we'd like to refer them to mental health care services as early as possible. And we want to emphasize education and monitoring throughout pregnancy and postpartum, and the use of a multidisciplinary team, including social workers. And we really want to use interventions that are protective. So increase family support and community support as much as possible, allow them to return to schools if possible, and also to allow access to what South Africa has available with regards to government-aided financial supports for them and their baby. And then we need to monitor for known or new onset mental health symptoms during pregnancy and postpartum, like I said, with regards to early intervention to improve outcomes. And then these young girls really do need long-term intervention for both themselves and their infants. The significant adverse event of having a baby during their teenage years has really long-term impacts on their mental health of themselves and their children, and they need to continuously be monitored regularly at their local mental health services if needed. That's it. So these are just the resources and thanks. Mostly they are journal articles that I've just pulled from and press releases. But I just want to also say thank you to so we work quite collaboratively with a PR company here that really allows us to get this information out in South Africa. And so Linda Christensen was very significant in making sure that we were talking about teenage pregnancy at the level that we needed to at the time, to make sure that people knew that this was a really, really significant health problem and that it had significant mental health implications. So I'm wondering if anyone has any questions.